Simultaneous extraction and placement is when we are making pre-made sites at the beginning of the day. So we design all the holes, and then we start extracting and placing the grafts at the same time. The holes are all done. When I'm extracting the grafts, it takes me probably a few minutes to have the first 40 grafts that are going to be ready. They're going to be put on graft organizers. So the two technicians can start placing at the same time, 20 grafts each. So the time between the beginning of the extraction to the time of the beginning of our insertion could be down to probably 10-15 minutes in most cases. So as you see, I'm extracting the grafts. One of my technicians are following me, and we always do this chasing method. Chasing method means I start from one side and constantly go to the other side. So we never go in each other's way. So she always behind me, removing the latest grafts that I've removed. When she removes those, she put them into graft organizers, and those are counted and sorted by the other technicians that is in charge of organizing and counting the grafts. When the grafts are counted and sorted, the placers start placing them. So as we can see them, the technicians can put the grafts on the back of the gloves in the group of 20s. So they bring the implanter, Mohebi implanter, down on the grafts and hover over the grafts, load them into the slot that is designed into the implanter, and then go back to the sites, find the hole, insert the graft, insert the Mohebi implanter, and inject the grafts and pull out and go after the next one. So the advantage of using Mohebi implanter for placement of the grafts is that the technicians can sit back using only one hand. There's not much of a activity around patient's head because we have a limited space. So we want to extract. 2 people are going to be extracting or removing the grafts, and 2 people at the same time can use a very small slice of the pie, if you can think of it, to place the grafts as the grafts are being extracted. So we want the technician to use longer distance range loops so they don't have to get too close to the patient's head. By doing that, we provide enough magnification without having too many technicians or operators head too close to patients. And as we start doing simultaneous extraction and placement, we usually start by putting patients on face down and doing the back area. And as we get to the sides, we change patient's position to this position, which is facing to the side. And when we finish this area, usually in an average size procedure of 2,000 grafts is the time that we are done with the first pass of extraction, which we have, if we're shooting for 2,000 grafts, we should have like 12 or 1,300 grafts before lunch. So make sure everything is placed, so grafts will not sit out of the body during patient's lunch. After lunch, we start with another pass of extraction and placement. So still, we have fresh grafts, we have fresh extraction, and followed by immediate placement.